to Road Gang Radio with Jimmy Mack, Lindsay Lawler.
Give me a minute, y'all. I'm coming.
And you, because if you're listening, you're in the gang. Take it away, founding member Phone Master Dre.
That I can sure do, because we just enjoyed that race across America. Now let's get to some health. Ain't that right there, Jimmy?
We're on the highway to health, one of the longest running segments on this platform, not just this platform, on radionemo.com. We've been doing this gig for a long time because part of making a living is making sure the most important piece of equipment in the truck actually is you, making sure that your health is where it needs to be to get you a little further down the road. And while the topic we're talking about today applies to all men, it must be pointed out that we have some special information for truckers as well. This is really important stuff, guys. You know, I am one of those people who, you know, like my father, I've been blessed with amazing health despite my best efforts, and often don't get to the doctor as much as I would like. This is one of those areas where I do get to the doctor as much as I possibly can and would advise you to. I want you guys to go to Testicular Cancer Awareness Foundation.org or testiscancer.org. Either one of those will start the conversation pretty good for you. You can find them on YouTube at Testicular Cancers. You can find them on Facebook at tca.org, on the X, formerly known as Twitter, at Testes Cancer. And by the way, I'm going to keep on saying this, guys, because I want you guys to understand that Testes Cancer is not a good scene. Instagram.com, TikTok.com, Testicular Cancer 2009, and on LinkedIn at Testicular Cancer Awareness Foundation. Shea Roberts joins us this morning. So thrilled to have you, by the way, Director of Operations for Testicular Cancer Awareness Foundation. Good morning, and thank you for making the time.
Good morning. Thank you so much for inviting us on today.
Oh, you got it. And by the way, I am making a joke because I want to be serious about this. So I'm 55, which means I'm free and clear, because after all, testicular cancer is the leading cancer in men ages 15 to 44. Hold on one second, right? It has no discrimination, does it? It happens to be big in that area, but it is everywhere, correct?
Absolutely. It can strike men at any age, from the infants all the way up to the elderly. Our eldest survivor that we have in our group right now was diagnosed at 69, and our youngest was diagnosed at 2.5 years old.
I want to let that land on all of our listeners out there. 69, we've been talking about that number this morning because of the elderly man who got in a fight with Mark Sanchez. Turned out to be tougher than people imagined. It doesn't matter how tough you are, and it doesn't matter how innocent you are in regards to 2.5, 3 years old. It is one of the leading causes of cancer in men, and as we'll find out today, it is treatable. It is. You can get rid of it. The problem is that people let it go until it's beyond just that area. Correct?
That is true. When it is caught early in stage 1, it is a very treatable cancer. It is one of the most treatable forms at that stage. But once it advances beyond stage 1, it becomes much more difficult to treat.
So let's kind of get into the numbers here, because this is something that everybody listening, every single truck driver out there who is male, who is listening, needs to pay real close attention to, because this isn't a rare occurrence. Talk about the numbers. And like I say, people don't always have a complete grasp of what those numbers mean, but these numbers are, well, they're alarming, which means you got to stay on top of it. Take us through the numbers of the impact this has across the American male these days.
Absolutely. 1 in 250 males will develop testicular cancer during their lifetime, which means that approximately every hour a new male is diagnosed with testicular cancer. In 2025, about 9,720 new cases will be diagnosed, and an estimated 600 men will die from the disease.
I want this to land, by the way. This is really important to me, because if I told you guys that you had a 1 in 250 chance of winning the lottery, you would play it twice a day. I want that to land, because I'm not one. I'm one of the 249. Those numbers are not good in regards to not getting checked out. Those numbers are not good in regards to not getting checked out. This is a serious issue. And by the way, you said in 2025 about 9,720 new cases will be diagnosed. Diagnosed. The thing about diagnostic means somebody went and actually got checked, correct?
That is true. And unfortunately, it is very common for men to avoid going to the doctor for cases like this, just because of the sensitive nature of the topic. There is a very high rate of undiagnosed or misdiagnosed cases.
And let's kind of talk about that, by the way. Let's kind of set up, the idea that, okay, look, first of all, whether you have symptoms or not, you still should get checked. Because if you catch it before you even have symptoms, there's a really good survival rate on top of that. But let's talk a little bit about little moments where we kind of go, hey, you know what? Maybe I should get checked out down there.
Yeah, absolutely. So the testicular cancer is over 95% curable when caught early, as I stated earlier. But half of the men delay seeking treatment until the cancer has already spread beyond the testicle, unfortunately. It is very important to do a regular self-exam. They are easy to do. We recommend doing them monthly. We have instructions on our website as well as some educational materials available. It is an easy thing to do. It takes 5 minutes in the shower, if that, and we recommend doing it once a month.
This is the thing too, and I like I said, I don't know. I'm not familiar with the numbers, but I feel like when it comes to women and breast cancer, that women in general have gotten on top of this. They have really said to themselves, you know what? There's all kinds of things that go along with this, and that there has been a culture in this country, at least, of being willing and open to talk about it among friends and family, and to do self-examinations and self-checks in a way that has not moved into. Let's be honest, men aren't checking their testicles. They're not, and they're not doing what they should be doing. And there's a real lesson to be learned from what breast cancer survivors teach us. Check, be willing to talk to a friend, find somebody you trust. You know, the idea of there's no shame in this. And for some reason, of course, because dudes are dudes in dude town, they won't do their diligence. And I mean, we're laughing because so much of this is the comedy of being a man that can lead to tragedy, right?
Truly, that is one of our main goals here at Testicular Cancer Awareness Foundation, is to just normalize the conversation. It should not be a huge issue. It's just a part of your everyday health care. It's no different, like you said, than examining for breast cancer on a regular basis. It should just be a part of your routine.
I want to do something here, and forgive me for doing this, but I work out a lot. I go a lot of hiking, a lot of jogging, a lot of that kind of stuff. Very, very active. I came in one day from a very long walk, and let's just say I was adjusting myself because I was uncomfortable from the walk. Well, my father, by the way, who at 82 years of age is alive and well, looked at me and he goes, "Are you scratching that there because you got a little bit of swamp, below, or something going on down there, son?" And I went, no, I get where you're coming from, Pop. I understand it. But he said, look, I'm going to tell you again, you ever feel anything for more than a day, you need to go immediately and get checked. Just looked at me point blank. And we need more men doing that to other men. Hey, dude, I noticed you touched yourself down there about 3 or 4 times over the course of the last 4 days. You might want to get that checked out. That's what we're talking about doing here, right?
Exactly. Just normalize the conversation, bring it to people's awareness and let them know, hey, if something feels a little weird, just go to your doctor. It's an easy test to get taken care of to check and see if something's really wrong. But, better safe than sorry.
All right, let's talk about risk factors. Okay, can you kind of talk about the risk factors? There are people who are predisposed to it. I mean, if it runs in the family, that's always been a consistent thing for cancer across the board. But talk about some of the things that might be like, hey, maybe I should get checked even more than other people.
Yeah, there are a few markers that you want to pay particular attention to. One of those being undescended testicles. You'll know if you have one. Yeah. And there are, other urological birth defects that just make you more prone to being at risk for testicular cancer. As you had mentioned, family history is a huge one as well, particularly brother to brother. I found this out last week during our testicular cancer conference that we held in Boston. It is much more likely that if you have a brother that has been affected by testicular cancer, that you are at a higher risk, as opposed to father to son. That still is a concern, obviously, father to son, but particular attention to, your brother. If you have a sibling that has been affected by it, or any other sort of germ cell tumor, so that extends back over into your sisters, not just brothers, but any sort of germ cell tumor in your family line will make you more at risk for testicular cancer. Let me
ask a really quick question, just a really quick question, because and this is a question born of ignorance because I want to know. As many men know, you don't get bald because your pop gave it to you. You get bald because your mom's dad gave it to you. Is I mean, does it skip generations? Does it get passed on from the mother's father to people? I mean, do we understand any more about that in regards to tracing back family history? Because sometimes you don't have a brother, and you don't know where the warning sign is coming. Where do you look for it in family members beyond just your sibling?
Unfortunately, there's not a huge lot of information about that. It is something, though, if your uncle has it, you want to pay attention. If there is any evidence of such a tumor in your family line, you want to make sure to be particularly cognizant of that particular issue. You want to pay attention to it if it's in your family. It is not specific to one side of your family.
All right, we've talked about the internal factors, and I have a feeling that I cut you off right as you were about to pivot into the externals. So go ahead and take care of that.
Yeah, absolutely. So we hear a lot about what are called forever chemicals, those PFAS. Those have a very high incidence of a relationship to testicular cancer. And it is unfortunately something that is very common. Pesticides and PFAS are very common triggers for testicular cancer. There is evidence of that, particularly in the military, in firefighters. The firefighting departments will use PFAS for fire deterrents. They're starting to kind of phase them out because they know what the relationship is now at this point. But it is something that needs to be paid particular attention to. And I feel that, with your audience, that is a particular interest.
By the way, with our audience, it's a double interest, and you're about to find out why. But I want to remind people that Shea Roberts is joining us this morning, Director of Operations for Testicular Cancer Awareness Foundation. You can find them at testiculaраwarenessfoundation.org or testiscancer.org. We got a double-barrel shotgun in regards to many of the people that are that you are talking to right now, maybe even a triple, because I actually know at least one or two, probably more than that, who are volunteer firemen, truck drivers in their community, and are veterans. And a lot of those people are trifectas that exist in this space. I wanted to ask, from a back in the day perspective, in the 1970s, anybody who grew up then knows about the bug machine that would roar through their neighborhoods, that pesticide blowing thing that would make the air stink to high heaven, but at least got rid of the mosquitoes and the chiggers for people. Can you does that count as a PFAS?
I'm not entirely sure, and I don't want to give out false information, but there has been evidence, as I said, that pesticides are linked very highly to testicular cancer. So I would, off the top of my head, say yes. But like I said, I'm not a medical expert. I don't want to give out false information. But those kinds of things do definitely raise your risk.
Better safe than sorry, by the way. If you're gonna give out a warning to say, hey, we don't know, but once again, go get tested, go take a look at this. By the way. As I told you before, a lot of our listeners, and we do a lot of stuff in the veteran space over here because there are a lot of veterans who make the move from the logistics of the military into the logistics of truck driving. It's an active service military situation as well, too, isn't it?
It is, yes. It is the most commonly diagnosed malignancy among active duty military servicemen. And like I said, it's highly related to the high PFAS exposure that our active duty military is exposed to.
All right. Let's talk about misdiagnosis because, like I said, my dad asked me that question that day, and he was like, are you sure? Are you just itching, or does something hurt? And there are a lot of confusions as to thinking you got one thing. And by the way, it's not just you thinking you got one thing. Sometimes a doctor will be like, I think it's just this, which is why it's always better to dive deep. And that's no pun intended. But it really is important to make sure that you sometimes get a second opinion. Is that what we're saying here? Talk about the misdiagnosis and what can be. It often is what gets mistaken for it. By the way, or strike that, reverse it.
Yeah. Unfortunately, misdiagnosis is very common with testicular cancer. It is sometimes mistaken for sexually transmitted diseases or infections. We hear about that a lot. And that will result in people getting, their antibiotic treatments or, a little bit of embarrassment from that kind of thing before they'll be on antibiotics for 6 months before they get a proper diagnosis. We also see people being diagnosed with varicocele or testicular torsion as well as epididymitis. Very hard word for me to say, so I apologize.
Did a pretty good job as far as I'm concerned. Better than I would have done. Well done.
Thank you. It is really easy to test for, but it is often overlooked. So it is something that you need to be pushing for your own. You have to be your own advocate in this situation. It doesn't always come from. There's not always pain associated with this, as well as I want to point that out. Sometimes it's just a lump or a bump. So don't think that it has to hurt for you need to get it checked out.
Yeah, and that's the thing too. Can we kind of talk about that for a second before we kind of shift over, and we'll talk about the specifics of being a truck driver and why it's so important to really kind of keep up with this, particularly, and we'll get to the truck drivers in a second. Let's kind of talk about what are the symptoms. Let's get straight down to the matter, because I've already gotten questions on the chat over on YouTube. People are like, hey, let's get to the symptoms. What should people look for on self-checks?
Yeah, what you are looking for is any change in, your testicle. You are looking for lumps, any growth. You are looking also for the actual testicle to expand in size. We see that very often. It is important just to keep an eye on the general size and shape of your testicle. You need to know your body and know what's normal for you. Any change to that is cause for concern.
Yeah, and by the way, this is a typical guy thing, Shea. I just kind of like literally a guy will sprain his ankle and be like, "I'll just walk it off." I mean, and that's what the mentality that causes this to happen. Oh, I got an abrasion on my arm. I have no idea how I scraped my arm. I scraped my arm. I ain't got to worry about it. Just put some mercurochrome on it or some other kind of chemical and just kind of move on with the rest of my life. But I'm being glib here because this is a lot of guys are very glib about the little aches and pains and bumps and bruises they acquire along the way, particularly people getting in and out of trucks and doing all that kind of work. This is why it is so insidious, because it just seems to be the acclamation of all the other kind of, bullshitski that we all kind of, develop over time. And that's one of the biggest problems. It's not so much a matter of, I don't think it's shame anymore, because a lot of the people that listen to my show, they're shameless. It's a matter of, that's how they kind of roll. But it's also a matter of it ain't no big deal till it is. Talk about the connection to the lifestyle of trucking, because along with the PFAS, there's other stuff too that you kind of want to, not just where the PFAS come from and all that exposure.
Yeah, truckers may face an increased exposure to the diesel exhaust, road chemicals, pesticides, stuff like that through the long haul traveling, as well as the time spent near industrial and agricultural areas. Like I said, these exposures are still being studied, but they definitely could be relevant risk factors. As well as truckers tend to be moving and grooving for long hours. You're not going to be kind of, feeling yourself up, for lack of a better explanation, on a regular basis just because of where you physically are. And you might be inclined to avoid seeking healthcare right away. You're on the road, you're busy, you've got things to do. And, most men are not going to admit that there could be anything wrong. As you stated, it's very common for men to just kind of wave things away. Women too. I'm not going to say that this is uncommon, but we're not dealing with women right now. It is just really important not to ignore any sort of symptom like swelling or lump or pain if it's there. Additionally, if you experience any swelling in your lymph nodes, so up by your throat, in your groin area, those are also concerns. Those are evidence of perhaps a more advanced stage of cancer. So that's even more concerning and important to pay attention to.
I want to also point out, and our listeners know this too, that the packages that are getting bounced around while you're on the road aren't just in the back of the trailer. Sometimes they're in the cab right underneath your seat, and it's important to remember that too. That's one of the other kind of insidious ways that we don't realize what's happening. When you spend that much time on your rump operating a truck, you kind of get used to the idea that you get glute issues, you get lower back issues. So a lot of times you're thinking, well, the whole area down there is in pain because I'm getting bounced around like crazy, even with the advent of the newfangled technologies that make the ride a lot easier. So that's the other thing too, is that what people don't realize, I think sometimes, Shea, is that often, what is the thing too? You know how when you're in pain in your overall body and that pain finally subsides after a long illness or something, you suddenly become aware of the fact that your ankle hurts that you weren't aware of because the rest of your body was hurting so bad. And I think what happens to a lot of these guys is that they're sitting behind the wheel of a truck and so much their legs are in pain, their arms, their shoulders, the entire core of their body is suffering, that it's kind of hard to kind of localize a problem, as it were, which is why it's so important to do. You're suggesting monthly self-examinations, right?
Yes, sir. That's why it's so important to take those 5 minutes in the shower or wherever you are to do a quick self-exam. We do recommend doing it in the shower because the warmth kind of lets things relax a little bit, but it does only take 5 minutes. Like I said, we have instructions for the self-exam on our website available for review. And you just take a minute or two every time you shower. Well, not every time, obviously, but once a month, and do a little exam and pay attention to your own body cues. I know it is hard to isolate those things, like you have, like you said, a lot of kind of noise coming out of your body with issues, but pay attention. It's important.
And by the way, if somebody notices something big, once again, I know people get worried about this, but in urgent care, there's always, and by the way, a lot of these men and women, the women who support these men know that there are things that they have access to, a lot of programs through the St. Christopher Fund. There are a lot of places where help can be brought very, very rapidly. Okay, we've only got a little bit of time here left, but I want to make sure, let's say the worst case scenario comes to pass, that you are told you have testicular cancer, but let's say it gets gotten early and that 95% rate kicks in. What can we do to assure that we end up in the 95, that we come marching in the 95 percentile?
Do what your doctor tells you to do. Make sure that you are working with somebody who has had experience with testicular cancer. I would recommend kind of asking your doctor, how many cases have you seen? There's no shame in asking for a second opinion. You want someone who's an expert because they're dealing, with the family jewels there. They're sensitive, they're delicate. And follow your medical care. Follow the advice from the doctor. Don't ignore it, and don't try to wave it away.
Yeah, that's an important part. And let me ask you this too, in regards to how long. Like I said, let's go through the 95%, the people who actually, because I want to make sure that people understand they don't get that sense of dread if it gets gotten early. How and as much as you can talk about, what is the process like? I mean, how long do you know about cases and how long they take? What that process is like when it gets gotten early?
If it's caught early, it's very simple. You receive what's called an orchiectomy. They will remove the infected tumor, stitch you up. That's a very easy procedure to go through. It sounds kind of scary, I know, but it's really not that big of a deal because you still receive testosterone from your other testicle. There's no real concerns as far as long-term side effects from that orchiectomy. And recovery is as long as it takes to recover from that surgery, which is not, it's not a very invasive one, all things considered. And you can be up and moving. They do obviously need to keep an eye on you. You will be tested regularly, scanned, blood work, etc. But if it is caught in stage 1, it's as simple as that.
By the way, thank you. Thank you for at least qualifying it, because the words minor and groin surgery, I don't think any man ever thinks should be put together in the same sentence. But I understand what you're saying. I completely dig where you're coming from, and it's really important to kind of do that. One more time with feeling, kind of tell us if people go over to the website. And by the way, I really recommend, if only for the best logo of all time, to head over to the website, by the way. But tell people what going over to the website actually can give them the information for and how it can help them down the line.
We have a variety of information on our website. Resources, we have explanations for how to perform a self-exam, what to expect if there are any issues that you see and are diagnosed with testicular cancer. In addition to that, we have several programs available for survivors, including a financial assistance program for patients currently undergoing treatment. We have testicular cancer conferences where we have survivors meet regularly. It's an annual program that we do once a year. Like I said, we just wrapped that up in Boston a week and a half ago. We also have some support groups available. We have a virtual online group that meets monthly called The Ballroom, as well as our private Facebook support group. That's a particularly popular one. It's only for survivors, and it's a great chance to talk about what your experience is like and what you're dealing with. We also have some blogs, a podcast called It Takes Balls that is led by one of our survivors and board members, and what we call the testimonials, where people talk about their experiences. And I write those and post them about once a month.
By the way, you're welcome back anytime to kind of remind people to do this. Just drop in and tell people. I would just have you come in for like 5 minutes and say, "Hey, it's your quick reminder, Shea here. Get yourself tested." By the way, fellas, really quickly, our good friend Trucker Boson wrote AFF exposure during firefighting training in the military. I mean, there's the trifecta for you right there. I mean, has PFAS and a firefighter in the military, and now currently driving a truck. Trucker Boson, all we're telling you, because we love you, is just make sure you keep on checking it out. And, that's an important thing, by the way. Well said, well done. Shea, thank you so much. Go have the best of weeks. You're always welcome to Highway to Health here. Really thank you for the great information. And by the way, and a little bit of fun. Appreciate you.
Thank you so much for having me. You have a great day.